Thank you for the lovely introduction. Yes, I am not Dr. Mishra, I'm Dr. Rogo-Gupta. Thank you all so much for coming on a weeknight, let alone a rainy weeknight. And thank you for the Stanford Health Library for inviting us. As she had mentioned, I'm a urogynecologist, which is a funny word, but hopefully by the end of all of this, it all makes sense. I'm joined tonight by our Pelvic Health Center nurse practitioner, Erin Sanders, who will also be available to kind of help meet and greet and answer some of your questions. The objectives of this talk is anytime we have a conversation, we want to make sure you take something home with you, some kind of information. In the beginning, we'll talk a little bit about the pelvic floor muscles. We'll try and translate doctor to English, as I like to say, so this all makes sense. Second, we'll talk about some of these pelvic floor conditions that are pretty common that you may have heard of or may be interested in, or there may be somebody in your life who suffers from one of these conditions. We'll review the basic pelvic floor exercises and at-home options that you can do starting today if you're so inclined. And then we'll talk about other treatment options if the at-home doesn't work. And we'll talk a little bit about our Pelvic Health Center, of which I am one of the founding mothers. It's our multidisciplinary care center in Redwood City. So if there is somebody in your life, a male or a female, who may have one of these conditions, we'll give you those resources to come and talk with us. So, pregnancy. Pregnancy is tremendous change. Who here has been pregnant before? All right, so we're all on the same page here. Babies aren't free. I just put it out there in the beginning until they come from Amazon or get beamed out of my uterus. They are not free. No matter what, if you've committed to being pregnant, your body is going to go through changes and it is not going to be the same as before. This is one of the biggest myths, so I like to talk about it early, that if I am healthy and I listen to my instructions and I plan how I want my delivery to go and I have my wonderful doctor, everything will go back to the way it was. And that's just not the case. That's just not how nature works. And I'll explain a little bit of that. Because your pelvic floor muscles, they're a group of muscles that stabilize the spine and the pelvis. And then you have to grow a human being. There's a huge workload on your abdomen, your spine, and your pelvic floor. Anybody who's been pregnant knows this. Anybody who's seen a pregnant person can probably guess this. But at the same time, we have these hormone shifts, which cause all of these tissues to become very soft and to stretch, right? It's preparing for birth. The body doesn't know what a C-section is. It assumes that this person's going to get squished down your pelvis. And so it's getting ready and prepared. And some of these changes are long-lasting, but really, they're forever. Let's be real. Delivery, right? I have pregnancy and delivery separate. Some people are pregnant for quite some time and they do or do not deliver at term or a healthy baby. So pregnancy and delivery are different, but delivery has a tremendous impact. Vaginal delivery is designed to be a trauma to your body. That's how it was designed. Not the best design. If anybody had asked me, I probably would have shifted some things around, but next time. But all women are at risk for these pelvic floor disorders, and it's very important to know that it could be from a vaginal delivery or a C-section. So we get that question a lot. C-section doesn't protect you from everything, okay? But they're so cute. We do it anyway. That's the thing. So did anybody, who was a good student? Anybody a good student? A few, maybe. So a little bit of education here. The bony spine, right? You can see in that center, it's connected to the hips, connected to the rib cage. Again, most pregnant people know that kind of difficulty with breathing, right? All of these bones are connected, all of these joints. So impact on one has a downward effect on the others, right? That's why we kind of have this holistic approach when it comes to pregnancy. When you hear your doctor say your pelvis, it's this butterfly-looking group of bones. They're different for men and women because the women's pelvises are shaped to try and get this baby down. But women and men have the same muscle groups. That's why, as I say in the beginning, if one of the things I'm saying relates to a man in your life, please also bring them in so that we can talk with them. So what are these pelvic floor muscles that I keep reading about? What does that really mean? It is like a bowl in the bottom of the pelvis. It's your floor that holds your organs that should stay in, and keep things that are supposed to stay out. They work with your other muscles to stabilize your pelvis, stabilize your spine. They also participate in sexual sensation. They are muscles that you don't realize are there and that we sometimes take for granted until they don't work. They go in the bottom of the pelvis. There won't be a pop quiz later, but I want you to have this realization that they can connect from your hip to your sacrum. So some people can have difficulty sitting cross-legged after delivery, for example, or certain positions can feel funny. That's not uncommon because there's these little muscles tethering from side to side. There's some that go all the way through the back. So people talk about low back pain, but wait a second, all of a sudden where I'm sitting, I have pain. That's new. That's where some of these muscles are. But the rest of them is this bowl, and you can see these little holes. So urination, intercourse, babies, stool, gas, all these things must pass through this bowl to exit your body. So impact to these muscles is impact to your everyday life, activities that you need every single day. I talk to my patients all the time about the fact that once you're potty trained, your parents say hallelujah, and they don't go and look again. Nobody comes back and says, hey, how's it going in there when you're an adult? And then you have a baby, and oh my God, these functions are completely different than they ever were before. And that is super common, but nobody talks about it. So that's why we're here. Everybody still with me? Okay, great. Not too much learning. I joke. There's so much to learn. I could talk all night. It's very true. Now, the pelvic floor, those muscles, like I said, they're the floor of your core, right? People talk about, I got to work my core. I have a weak core. They kind of think of those abs, those transverse abdominis muscles. You talk about the back muscles, right? Like if you have a weak abs, you might pull your back, those muscles there. But this is the bottom. And if you think about the pressure that can be generated in there, the pressure can go anywhere. And it's physics. If you have a high pressure, like this big baby, it's gonna go to your weakest spot, right? So you're gonna get reflux, right? You get that acid, you might get the little belly button hernia. And what's on the bottom? The pelvic floor. So you can weaken that pelvic floor also, right? This is very important. And, you know, I see always the light bulbs go off when we talk about it, but you don't really think about it, right? Otherwise. So don't forget that this matters. For example, did you know when you inhale, your pelvic floor muscles actually descend? And when you exhale, they lift. These are just little things that happen a million times a day that you don't realize. So now that we've done enough kind of traditional learning and anatomy review, let's talk a little bit about these conditions that happen. And we're going to highlight the most common ones tonight. So remember what I talked about with pregnancy. You have this big baby, you have these stretch changes in pregnancy, which naturally causes nerve and muscle damage. Did you know some of the nerves that go to your anus, for example, and urethra, stretch to be like 30% longer than they ever were before? This is real. So it stretches like that, and your joints are unstable. Now, think about that scenario. If you played sports, would you play the most important game of the year when you are at the highest risk for injury? Of course not. No one would put you on the field, right? But that's literally what pregnancy is. It's setting you up, right, to be injured, and then that's that moment. And don't get me wrong, I'm an OBGYN first. Delivering a baby is the most magical thing I've ever done. I have 2 daughters myself. It is a wonderful blessing. I love them. But, you know, they're not free. And so it's a very serious decision because your body's not the same. So what exactly happens, right? What happens in delivery that can cause all of this terrible things that you're talking about? Well, there's stretch injury, and the longer you push, the higher the risk. Who pushed less than 1 hour for their baby? Yeah, they don't fly out like that. Who pushed 2 or 3 hours? Anybody? Okay. Anybody more than that? 4 or 5 hours? Longer than 6? Okay. There's a reason why these traditional numbers exist in terms of limiting how long you push. It's not because anybody has to get home for dinner, although I can't speak for everybody in the world, but it's really because of this realization that maternal injury increases over time. You put a giant baby that squishes everything in your pelvis, what's going to happen? I don't know if you've done any international work or if you're aware, but maternal injury as a big cause of death still to women worldwide and still in the United States. So it's something that I feel very passionate about. And I think it's easy to forget that we're fortunate in the first world and we have really great care, but there's women all over the place that are in the United States and abroad who are suffering. So this is kind of why I'm so passionate about it. There's also a theory that there are some women who genetically might not be as well primed to allow the baby to descend. We can't necessarily predict it in any individual woman, but always talk to your doctor about these possibilities or what happened with your mom, your sisters, anybody in your family that you know about. These are examples of different types of vaginal delivery. Either you can push that baby out or it needs some help out, right? Either with the forceps. I was born by forceps, turned out okay. My head softened out, or a vacuum where we put a little suction cup on the baby, right, and gently help the baby out. So what happens there? So a little rated PG, this is what happens under the skin. People ask us, how many stitches did I get? We actually don't count stitches, right? We count depth. You'll hear 1st degree, 2nd degree, 3rd degree. These may sound familiar. And that has to do with what's underneath the surface. So there's lots of muscles and organs underneath. If you're curious or you know what happened to you and you wanted to ask more, come contact us. That's where Erin and my group are really happy to go through it with you, help you explain it, and talk about what implications that may or may not have for your future. We're happy to do that. So what about that C-section? Okay, sure. There are some things that are more dramatic after vaginal delivery, like having more urinary accidents, for example. But like I said, C-section doesn't completely protect you from issues. And so I think that whether it was a short time ago or a long time ago, if you have any questions about the details of the delivery, please do come let us know. We do know if you had one of those helped deliveries like I was describing with the forceps or whatnot, you do have a much higher risk of having vaginal problems later, okay? So when do these symptoms start, right? Women have children at all ages now, much older than we ever used to, also still young, but these symptoms can start at any time after delivery. Many of them start relatively immediately, but they kind of come and go, okay? Good years and bad years. If you have recently had a baby and you have some of these bothersome symptoms, there is some good news that most of the time those symptoms will get better or even resolve by about a year. So that first year postpartum is a really important time for us. We really believe strongly in rehabilitation. So we want to see you right away because we want you to get the most out of this first year. Back to the athlete analogy, if you had any kind of a sports injury, would you just wait and see at home and lay in bed? No, you would go to rehab, you would do your stretches, you would do what was recommended, and we strongly believe that you should respect the delivery just as much as you would respect any other kind of injury. If someone doesn't have pain, they can often start exercising within a few months or even weeks. We start walking pretty quickly now these days, but there's other behavioral strategies we'll talk about to review as well. So what exactly happens? So if pelvic health, right, is everything going well, the opposite, we say, is some dysfunction where one of those organs isn't emptying well, isn't holding stuff well, or just kind of feels out of place. So who needs to know about this? Who out there should I really share this with? Everybody. Definitely there's an increase with age, but you see the 20 to 39-year-olds, it's not 0, it's still 10%. And we see all ranges of ages in our clinic. I see 19-year-olds, I see 109-year-olds. So we are happy to talk about it at any stage. That also is a little known fact, is that this happens to more women than high blood pressure, more than depression, more than diabetes. And those things we're very happy to go ahead and see a doctor and talk about. One of the saddest things for us is that we know that urinary incontinence, for example, some accidents of urine, that's rated the #1 most embarrassing health issue by U.S. women. People don't want to talk to their doctor. Only about 16% ever have. And even worse than that, then only 10% of those women ever got offered treatment past medication. So even though we're in the United States, there's still a long ways to go. So we want to talk about it. We want to bring this to the forefront. So please, since you are here today, I'm sort of preaching preaching to the choir, but go ahead and take this information and disseminate it yourself. That will make us very happy. So everyone is at risk. So what are the other risk factors, Lisa? What if I didn't have a baby, but I have these symptoms? Does that make sense? Absolutely. Risk factors like chronic straining. I've seen patients who are professional weightlifters, professional dog walkers, food service workers, anything that has that chronic strain. Even if you don't have babies, it's going to put you at risk. Age, so that's my Nana, who's now 88. So she has different pelvic floor issues than I have in my age group. But my daughter, who was then 2, also had her own potty issues. So it's different again at any age. Genetics matters. There's some differences depending on your background. If a first-degree relative, so if a sister, for example, has an issue, yep, you're more likely to have it yourself. Don't smoke. And weight is an issue as well that can contribute to these symptoms. So there's things here for everybody. So the first condition that we'll talk about tonight, I had just mentioned, in medical terms, it's called urinary incontinence, but essentially you start to urinate or pee in a situation that you don't want it to happen. And there's some different pictures. So you might feel like the lady on the left. No mom's on the trampoline because everybody knows you have to cross your legs. That's that leakage that as soon as you put a little bit of pressure, the door opens and it can come out. It may be a small amount, it may be a large amount. It may not bother you. The middle lady, so that's the ones of us who know where every bathroom is between my house and wherever I need to go. That you start sitting in the last seat in the movie theater because you want to easily be able to get up and go to the bathroom without disturbing anybody. Maybe you get up in the middle of the night because you have to rush and you have to go. There is, on the right-hand side, those of you who just drink too much. And the more you drink, the more you pee. Those of you who walk into my office with a liter full of water and drink it in front of me, telling me how much you go pee. There's different recommendations for fluid out there. Who tries to get their 8 to 10 glasses per day? We're trying to get away from that a little bit. Depending on your medical condition, talk to your doctor. But quite often, if you're a normal-sized person with a normal routine, that's a lot of fluid, and you will be very likely spending time in the restroom. And if you like the restroom, and after you talk with us, you feel comfortable with the restroom, I don't know, this is a beautiful building, I'm sure the restrooms are lovely. If you don't mind it, then that's totally fine. But let's make sure that there's not anything that's, bothering you in your lifestyle. So do I really need to do anything about it? No, but it can be expensive if this is happening. It's a huge cost to the population, we know. And just the fact that some people start to isolate themselves. They're worried about the odor. They're worried about intimacy because they're worried this might happen during intercourse or when they're with their partner. They're nervous about dating and meeting a new partner. So that can lead to depression. If these things are happening in you or somebody you love, then we really want to go ahead and talk about it. So there's another condition, moving on from the urinary leakage. There's something you may have heard of called prolapse. Has anybody heard that word before? Okay, great. So what does this mean? This means that muscle floor I told you about, that floor of your core, all of a sudden the organs start to sink and they start to collapse through that floor. It can be any of those pelvic organs. It can be a combination of it. And you might feel, I feel kind of like a heaviness down there, or I feel like I was wearing a tampon and I didn't take it all the way out, or I just feel something different there. Some patients might wipe and you might say, there's something there that wasn't there before. You can look at it if you want. You don't have to. We can look at it too. Come and we'll kind of show you the lay of the land, so to speak. But that's not uncommon either. It actually is present in over 40% of women who are over age 50. That's a lot. Because a lot of the time, it's not doing any harm. Many women don't really know it's there. But about 11% of women will have surgery for it. So it definitely is around enough that you might run into it at some point. And it's something that we check for at the time whenever you come see us for the first time. That's one of the things that we're checking for. And we can help give you that feedback as to what's going on in your own body. There's another kind of group of conditions, having trouble with bowel movements. One of the more bothersome can be when you can't control those bowel movements. Some people know they're coming and can run really fast to the toilet, and some have no idea that it happened until they get to the restroom. There's certainly a lot of impacting factors, people who have diarrhea or looser stool, people that have constipation or firmer stool or a harder time getting it out. But sometimes before you have the baby, you can manage that. You kind of have it under control. After you have the baby, there's some damage to the muscles of nerves near the exit, right? And then all of a sudden, it can take those manageable issues and make them unmanageable. And that can be a big social problem as well. So if this is happening, please, we want to hear about it. And it happens if you have inflammatory bowel or IBS, about 20% of people it can happen to. So if you think you might be at risk, we have providers for you at the Pelvic Health Center, and we'd like to see you. So now we kind of introduced a few of the groups of the urine, the prolapse, and the bowel of some of the most common conditions. So let's talk about some at-home options, because everybody here is super busy. That's why I feel so fortunate to have all of you on a weeknight for an hour. I feel so lucky. But there are things that you can do at home. So some people have heard about this. What things can irritate, right, to avoid or reduce? Caffeine, I'm so sorry. Caffeinated drinks can be bladder irritants, and they can also give you that urgency to have a bowel movement. Sometimes that's okay and good, and sometimes it's too much. So if you're having the equivalent of about 4 cups of coffee per day, not 4 ventis, but 4 6 to 8 ounce cups of coffee, it may be significantly impacting your bladder. Sodas are irritants and they have no nutritional value. Please just stop drinking them. And wine, alcoholic beverages, they can be irritative, but they can also be diuretics, which means they can tell your body to produce more urine. So if you find yourself getting up at night and you really like your glasses of wine in the evening, that may be kind of an easy way to just cut back on that wine in the evening. You may sleep better at night. So those are just some little things that you can do at home. Something called the knack, where they say squeeze before you sneeze. So you can learn how to squeeze those muscles, and we'll get to that. So if you feel a sneeze coming on, you can do it. I see many teachers in my practice, and they know how to do this because they're sort of talking like I am, and they automatically know to just go ahead and cross their legs. So they just kind of change their position because having an accident in front of a classroom can be very distressing. What else can I do? Weight control. This is real. This is a big one. We know if you're overweight or obese, if you lose about 8% of your body weight, you can have a dramatic improvement on your urinary leakage, for example. So if you needed any stimulus or encouragement to maybe lose weight, I will give you more. It'll help on your pelvic floor, so I will support you. There are kind of a version of tampons that you can buy over the counter that can help block the leakage as well. That's an easy one. You can try at home and see if it works for you, and if it does, that's great. And if it doesn't work, come on in and we'll talk. And you don't have to wear pads or just-in-case liners anymore. They make underwear that absorbs urine now. So this lady in the black underwear, that black underwear actually absorbs urine. So there's a way to have a just-in-case plan, but still be at the gym and not feel embarrassed. So there's a few things you can do at home. So kegels. Can't really have a pelvic health after delivery talk without talking about kegels. And they can be really tricky. Has anybody ever tried? Okay, right? Because they say, do your kegels, and you want to be a good student, naturally. The trickiest part is finding the pelvic floor muscles. So we'll talk about it for a moment. We instruct patients to help identify them by trying to stop the urine, right? Midstream. When you're going, try it and see if it works. Now, that's just to identify the muscles. Remember, don't keep doing that because you don't want to give your body the message that you don't want to urinate, right? You want to only send it positive messages. But in the beginning, you can use that to help identify. Then, when you do them, you want to be sitting or laying down. You want to try and squeeze and engage those same muscles, but really focus on not using your abdomen, your buttocks, or your thighs. It's actually really hard. You don't hold your breath, right? Because you're squeezing a muscle. You want oxygen, just like when you're working out. You want to make sure you have some good deep breathing. And you start for little 3-second holds, and you want to slowly work up. There's some different information about how many to do. but you want to do some different sets. So again, the most important thing is to hit the target. So if you're open, you can do a practice right now as I describe it, where you take a deep breath in to relax, identify those pelvic floor muscles, try and tighten them, see if you can hold it for 3 seconds, and relax for 3 seconds. Now, if you can do about 10, should take about a minute, that would be what would be recommended. We typically talk about 3 to 5 sets in a day, so you can think about it as like on your commute or breakfast, lunch, dinner. Some people will say if you watch a movie or TV at night, do it in the commercials, and that will eventually add up. Whatever you can kind of do to make it work, I will support you. Just remember to do your deep breathing. So will Kegels really help me? We get it a lot. Patients that come and say, I tried it, it didn't work for me. Well, there is some scientific evidence. If you can do them correctly, they can help you with the leakage. You can leak less in volume and go less often. Patients have said it can improve their quality of life. Our National OBGYN Society therefore recommends that we recommend it and teach people to do it. And if you're hitting the right target, about 75 to 80% of women improve. So if it's not working for you, we want to hear from you. That's really important. So when can you start? Right now. Even if you're pregnant and you don't have it, you can start now. Come see us. Let us go through your history. Let us test your strength. And Erin will give you a home program that you can begin right away. If you've delivered, you are very likely to be able to start them early, but same thing, we kind of want to evaluate you first just to make sure that you're doing it correctly and nothing dangerous is happening. You can come for an evaluation anytime, but usually we'll say if you've tried it consistently for about 12 weeks, and life is busy, but if you've gotten it down for 12 weeks and nothing's happening, definitely consider other options, okay? We kind of would like to hear from you. And I'll talk more about what that might mean, but at least come to us if you don't mind. So in summary, the things that you can do at home, starting today or tomorrow, maintain that healthy weight. Do some of these pelvic floor exercises correctly if you can. Try and keep away from bladder irritants and don't smoke. Fiber is a big one. I didn't get to talk about it too much here, but making sure your bowels are moving smoothly is very good because if you get backed up in one area, the other area is going to also misbehave. And again, please, if you need help to stop smoking, please contact us. So let's talk about if that doesn't work. So you might say to me, I've been doing this and nothing's happening. Now what? Let me talk to you a little bit about what could happen. So we might talk about seeing a pelvic floor physical therapist. Who's heard of that? The trainer for your Kegels. We believe very strongly in this, and that's why one of our team members is a pelvic floor physical therapist at the Pelvic Health Center. And we're fortunate. We're in California, in Northern California. We have a lot of trained people, but it's important to have the right person. Why? Because perhaps you can't find those muscles. You've been trying it and not realizing you're squeezing your glutes, for example. Very common. Poor endurance or strength. You kind of get there, but you're not there enough to actually squeeze around these organs. Maybe you're having trouble coordinating your breathing. Maybe your positioning is off. This is very important. So there are some devices that you can buy and try and help you do these home Kegels. They're available on the internet, and some of them can be helpful and some are less helpful. So if you have ones that you're interested in, we recommend you bring us in, a printout or the website, whatever, and we can kind of talk about what data there may be for or against that particular device. For my patients, I really feel strongly about a customized regimen. I think if you even have the time to have a few sessions with a physical therapist, it's really good because you want to sort of set yourself up for success. Before you start doing P90X, before you start going back to the gym, before you start doing these different physical activities, you want to make sure that you're not going to cause yourself harm somewhere else in your body. And that's exactly what happens with the pelvic floor. You do a million sit-ups and then all of a sudden you feel your bladder coming through your legs. And people are very distressed when that happens because they think they've done something good for themselves and then they have this unfortunate side effect. So please come see us first and we will help bless you on your physical activity style. Now, what does that involve? Well, Don't worry, they're specially trained physical therapists. They do tend to be women. Even though they treat women and men, the therapists themselves tend to be women. They're private sessions. They help assess your core, your posture, your lower back, and your hips. You'll get a set of guided exercise. If you suffer from back pain, sciatica, other things as well, they can help work around those conditions. They're going to talk about some behavioral strategies, and your sessions really vary how often, depending on what your condition is, what other medical conditions you have, and what your goals are. What else do we have? Well, if this is you, and you leak when you're on the trampoline and you hike the dish, we may have something called a vaginal dish that may be helpful. We may have a surgery. We may have an office procedure. There's different options depending, again, on our conversation. If this is you, the person who runs and has that urgency, that overwhelming feeling of, I need to go right now, we may try and retrain your bladder. We may try and put you on a new schedule. We may try medications. Acupuncture-style therapy also works great for this. Patients report it works as well as medication, or maybe even better without the side effects. Sometimes we use medications that we inject in the bladder. We have sort of an implanted acupuncture option. So there are things, if you're interested, we're more than happy to talk to you about it. And of course, you come to talk with us. You never have to commit that day. Now, what about treatment options for the organs falling down? Well, if it was 400 BC, we would hang you upside down and you would have fumigation therapy. Lucky for you and for me, it is not 400 BC. We've evolved a little bit since then. We have similarly little lifts to actually physically hold up those organs for you. That can make it also easier for you to do those Kegel exercises if you don't have those organs in the way. So it can be a complement to the other therapies. And there's different surgeries. There's many different types. There's not one surgery for any one woman. You read a lot of things about gynecologic surgery on the internet, so it's always good to go ahead and get your customized exam and talk to your doctor about what might be right for you. There's other things you should do. Try not to increase that intra-abdominal pressure. Try not to do that heavy lifting realistically. Running, how many of you are runners? Yeah, okay, we got a few. We don't love running. I'm so sorry. I have lots of patients that run, but that's a hard one on your pelvic floor. It's the delta of the start and stop that can be challenging long term. So if you are a runner, definitely start with your PT now. And carrying, I love babies, love them. And do I pick up my kids every now and then? Yes. Do I know in my brain you shouldn't be doing this? Of course. I've can't help it, right? I've wanted a baby forever. That's me at 10 years old, holding my cousin, so excited. I had asked for a baby and I got one. And then finally I got one of my own and I was just so elated. It was just the best moment of my life. So of course I'm going to pick them up when they want me to now, but try to think about it as like a long game. Try to wean them off. Try to make sure you're doing little things in your life that don't require you to lift long term. When it comes to bowel accidents, work on your stool consistency. The optimal stool consistency is like a toothpastey consistency, comes in 6-inch pieces or more, comes usually in the morning, about within an hour of first waking up or first eating something. Work on, we have some options for you called biofeedback. The acupuncture style therapy might be for you. We have other types of treatments that we have. So if this is something that you want to talk about, we are here for you. We have people. So in summary, preventive health and good health isn't just going to the doctor once per year. I've said it before, I'll say it a million times. It's really a lifestyle decision. I feel blessed to be in Northern California where people are aware of this and they care about it. And we have resources to make that happen. We have wonderful weather that we can walk every day. Even when it's raining, it's not really that bad. So you can really easily incorporate some of these in your life. It's just hard to institute a change, right? But if you've committed yourself to being pregnant and or having a delivery, there's going to be changes and they're not going to go back to the same as it was before it. So just identify the things that are happening and know it's common. Know that many things resolve in 1 year, so have a little bit of patience. But know that there are treatment options and there are providers with special training, and we are here to help you. Come see us. Open arms. This is our new center in Redwood City. We are multidisciplinary care clinic. That's the phone number there, shameless plug, where we are happy to see you and talk about these things. This is a safe space where we talk about this all day long. From the urogynecology perspective, that's myself, my partner, Dr. Mishra, my senior partners beneath, Bertha Chen and Eric Sokol. Erin Sanders, our nurse practitioner, who will help coordinate a lot of this care for you because it can be a little bit overwhelming, and work on education. Lucia Miller, our physical therapist. Beyond that, there is Beyond Urogyne at the Pelvic Health Center, as I told you I would tell you about. We have specialists in gastroenterology and motility. If you have one of the inflammatory bowel disorders, if you have bloating, if you're having trouble with digestion, or you need to look through your nutrition and figure out what's the right combination for you, we have people. We have surgeons in case the hemorrhoids never went away after that delivery, for example. We have urologists if you're having bladder infections or stones. We have specialists in pelvic pain as well, or sexual pain if that's an issue for you. So part of what we do and part of our primary role is to talk to you, listen to what your symptoms are, think about that combination, and help you kind of put together a good team for you in a way that'll help you reach your goals the fastest. Here's our staff. They're fantastic. We have one here today. Yay! And we are more than happy to take your questions in a little bit. I have our website up here, and apparently we're on Twitter. So feel free to follow us on Twitter. I'm not on Twitter, but the Pelvic Health Center is on Twitter. So thank you guys so much for your attention. I'll bring Erin up here, and we're happy to take any questions. Any questions? Yeah.
It's kind of hard for me to identify my pelvic floor muscle. Before I come to you, is there any way that you can guide me to identify them? Is there what can I do to figure out? And as you say, it's the glutes, it's the other muscles. Where is this pelvic floor muscle, and how do I know I'm activating it?
That's a great question. Would you like me to talk? Yeah. Oh, yes. The question was, how do I identify the pelvic floor muscles? Because it's very hard for me to know exactly what to do. So there's a few different tricks that I usually will recommend. Historically, people would be taught, okay, if you are having a good urine stream, try and squeeze and see if you can stop the stream from happening. That's one option. Another, I think, that is a good trick is that you can use either a tampon or your finger, something that you feel comfortable with, and you could put it inside the vagina and see if you can feel yourself squeeze around it. That's what a lot of these things that you can order online. Eggs, they come in all shapes and sizes. They call them dilators. They're like super tampons. A little something in there that if you try and squeeze it, you'll feel yourself around it and you'll see it move, right? Your buttocks will stay on the bed. You won't be lifted off the bed, and you won't feel like you're doing a sit-up. Those are some little tricks at home. Do you have any other tricks that you like to use?
I tell women typically in the shower, because it's a clean space and you're already in there, that you can certainly try and inserting either one or two fingers. Sometimes if you're very if the vaginal walls are loose, it can be hard to even squeeze around only one finger. So inserting two is kind of sometimes helpful. And if you still are having trouble, I think it's really important to actually be evaluated by somebody to help you, to help you. And even if after you see us and we realize that you're still having trouble, even when we're saying these are the right muscles and you're still unable to contract, which does happen quite often. We have even something called biofeedback, where we can actually use electrodes to help you actually visualize the muscular contraction of those muscles. So there's a lot that is out there. Yeah, sorry.
Great question.
Can you take the biofeedback home and try it out on myself and see
Yes.
if it works?
Repeat the question.
Oh, the question was if you can have biofeedback. See, that's why we need to be a team. And can you take biofeedback home with you? And the answer is yes. There are home biofeedback devices.
It's such a good question.
Absolutely.
Our physical therapist, actually, we were just coordinating because this is something that a lot of women can do. Even if they're getting physical therapy, it actually optimizes your physical therapy because you're able to do the work at home and do it correctly. And so we actually see better outcomes over time if women are able to use those biofeedback units, and you're able to rent them. You can purchase them outright, but those are all available. It is by prescription, so we have to submit something on your behalf as a provider for those units, but it is there.
Great question.
Good question.
I have a follow-up.
Oh, okay.
I'm wondering about the pelvic girdle pain that some women have. Would this biofeedback for the pelvic floor muscles also help the pelvic girdle pain?
So the question was for women with pelvic girdle pain, whether the biofeedback will also help with that. And the short answer is yes, because this is part of that stabilization of the pelvic girdle. So it probably won't be biofeedback alone. There probably will be some stabilization, some work on posture, sleep position, walking, gait. So there'll be a family of things, but most likely, yes, biofeedback will be a part of that.
Right, and ruling out other causes of that pain to make sure we're treating the right thing.
Of course. Safety first. Any other questions? Yeah.
Hi, I have 2 questions. I came today because I haven't started having kids yet, but I'm about to embark on the journey, and I thought I could get like some good stuff so I could like kind of win out on this and and be prepared. But I didn't hear you say anything that I could do to have these issues, and so that would be my first question.
Great.
And then, do you want me to ask the second one now, or just?
Oh, sure, go ahead.
The second one would just be, is all this related to the possible vaginal wall looseness that people talk about after giving birth?
It's a great question. So the questions were, what can I do if I am planning to become pregnant to help prevent it from happening? And secondly, does this all have to do with the looseness that can happen with birth? So the first question is, I am so sorry I didn't talk about prevention. I'll talk all night, but I always forget something. The physical therapy has been shown to prevent. We have good data to show that it can help to prevent also. So it is great for that as well. It hasn't been shown on a large population level, that's why it isn't part of your sort of intake when you're planning to get pregnant. They check off all these boxes, do you have high blood pressure? Do you have diabetes? All these things. They forget to ask about this. But it has been shown to help prevent. So definitely that physical therapy is a good option. Maintaining the weight actually and controlling your weight gain in pregnancy is going to be an important one just because of these stretch properties, and the more gain, the more stretch. And just trying to optimize also your bowel function in pregnancy. It's an interesting change I see. Very often the bowels become different, perhaps, afterwards, for lack of a better phrase. And I tend to see people like 10 to 20 years in who've been straining for bowel movements and didn't even really realize it adds up in the background. So I would definitely say focus on that bowel function. Those would be kind of the things that I would think in the very beginning for helping decrease your risk of having these. The question about the looseness. So actually, no, it's not necessarily loose either. Many of them are like that prolapse and that falling down. Certainly, there has to be a looseness in that pelvic floor. But those muscles, if the sensation gets damaged, one of the things that can happen is in the background, and it can actually get tight. You cannot realize it that we call it a high tone. And in the background, it's actually squeezing hard and then making it harder for other things to exit. So one of the reasons why we feel very strongly about getting an evaluation early and meeting people as early as possible is that it's really hard to sense down there and to know if it's tight or loose, working or not working. So we really like part of that assessment early on. Thank you. That was a great set of questions.
It's a great set of questions. And if our physical therapist was here, she would certainly say that everybody needs to do physical therapy before pregnancy, or before delivery, rather, during their pregnancy. And that's just to sort of optimize and prevent complications afterwards. She's a big proponent of that, which I know. But as Lisa was saying, other things that you can do are just taking care of yourself, really walking, eating the right things, doing all the things that they tell you that you should be doing during your pregnancy, controlling the weight gain, like you said, all things to reduce the pressure on your pelvic floor, learning to identify those muscles before you deliver. So you're not now with a newborn and trying to learn Kegel exercises with no sleep and, maybe your baby will sleep. But sort of doing things before you're in the trenches, I would say, and learning more about your body and working on your behaviors and acknowledge things that you might be doing in terms of the amount of water you're drinking, or if you drink or a heavy coffee drinker, or you drink a lot of soda, or all of those things. If you are already smoking, which hopefully you're not during your pregnancy, but things to work on, certainly. Yeah.
Absolutely. When you're the clearest of mind.
Exactly.
Which is now, because never again.
So I'm actually a pelvic floor physical therapist.
So we have a pelvic floor physical therapist in the audience for those of you at home.
And I cannot thank you enough for just how you're talking. I've never heard a doctor talk so holistically about the pelvic floor and the pressure and managing it. So I just, first of all, huge shout out.
Yay.
Yeah. So I have kind of two questions that I am thinking about. So as we know that our country is a little we so far ahead yet so far behind, especially for maternal health care. And one of the things I'm noticing, because I'm part of a global forum for physical therapists, is starting the changing even in the hospitals about getting physical therapy. And I'm thinking, Stanford I would love to see being on the frontier, maybe even physical therapy immediately to kind of inform women off the bat about all that stuff. I'm happy to potentially join forces and launch something about that. And then the other thing is, it's so great to hear the kind of changing dynamics in postpartum care. 6 weeks after, it can be so focused on the baby, and the moms are so important. And one of the things I would love to see change is that 6-week follow-up appointment for moms, where I feel like postpartum depression has become really highlighted in such a positive way. It's getting more attention. I would love to see that in regards to physical health. So it sounds like you are completely on top of that, and I'm hoping that also just the change of all doctors and OB-GYNs sort of changing their questions on that 6 week, and then really sending them to the right places.
Fantastic. For those of you at home, we have a pelvic floor physical therapist who is on our same train of thought in terms of pushing women's health care forward and asking questions regarding how maybe Stanford and those of us who are involved in the field can push things forward, essentially, to summarize. Well, I can tell you that, yes, we are working on some things. So, for example, the American College of OBGYNs and Stanford specifically is actually moving more towards an in-person visit between 1 to 2 weeks to go ahead and check your pelvic floor and check your wound. I had one today. Make sure things are going well. That could also be your depression screening moment. A phone call from a nurse as well in that time period. In addition to that 6 week, we're pretty sure that 6 weeks number comes from nowhere. And it is really unfortunate because there's no data behind it. Right. Wound healing, we know some things about wound healing, that the first 6 weeks is a big deal. That we know, that's real. Right. But it doesn't seem to have anything to do with postpartum time. So we are trying to change that, and at Stanford, that's what we're moving towards. Part of Erin and my role is that we would, part of our growth and our whole design is that we would like to integrate a visit during the pregnancy and then have scheduled already your postpartum time. We obviously need the manpower. The Pelvic Health Center has been many years in the making. I've been working on it for I guess 5.5 years now, and it was in process before I came here, so it's finally been born. But that's why this kind of a team was created, so that we have those resources. Our pelvic floor physical therapist is interested in growth, and we are interested in developing a small army. So please do contact us, because it would like that as well. I think you're absolutely right. I think there's been a lot of focus on the baby, which is important, but we're trying to put the maternal back in maternal fetal medicine. So we are definitely proponents. These types of events, try and get the word out there, I think is really important. The more you can do. We would like to have group patient education classes, and that's part of Erin's role, is that we're going to go ahead and start those as soon as we can get sort of the resources and the support and physical space to do it.
To make a community of women who are all dealing with the same struggles.
Absolutely.
Yeah.
So we are with you.
Great.
Join us on our journey.
Yes.
I agree. So she had mentioned that United States is ahead yet behind. In Europe, in many countries, you have your standard physical therapist. They come to your home. It's very easy for you to go ahead and rehab in a safe space. But remember, in other countries too, your family takes care of your baby for the most part, right? Mm-hmm. You focus on yourself. You feed your child, but the rest of everything else that goes on in your life, you have your whole family with you. And here in the United States, we're often without that. We're not with our immediate families. We don't have our support. I went back to work 6 weeks after I had my first child. It's not right. It's not ideal. It's the world we live in, but we have to make that change. Like, no one's going to make it for us. So looking at these other countries and looking for a better way is definitely the first step. And that's why we designed the Pelvic Health Center to be the first of its kind here on the West Coast. And we hope that we can get the word out and kind of, again, create a group of women and men who can advocate for us, because that's where it's going to go up, higher for greater change for the community.
Yeah. So we certainly have a long way to go still, but the fact that we have a pelvic health center is amazing, and that we're addressing the pelvis as a whole and not by each compartment separately is just above and beyond what has existed previously. So turning the Titanic is slow business, but we're in that business, so we're trying. Yes.
So I gave birth in Sweden, and in Sweden it's completely midwife-led. So I had a twin pregnancy, so I had a doctor present, but I had 2 midwives, one for each baby, and it was a whole thing, and it was at 40 weeks. But so what I wanted to say was that don't be too hard on yourselves, because at my 6-week follow-up, no one even looked at my pelvis in Sweden.
So we're just learning that Sweden, despite being ahead in many ways and very organized in terms of healthcare, doesn't necessarily involve a perineal examination at 6 weeks. Okay, so we won't be too hard on ourselves, but we can always strive for better. We're Stanford, we're going to only get people who want to do better. No, that is very interesting to know. I did not know that about Sweden. So you can take back everything you learned here today as well.
I'm staying here.
Oh, okay. Oh, I think I see another question.
Can you tell me, is there data that supports the idea of instigating this kind of pelvic rehabilitation as a cost prevention? Where does it fall further on down the line in women's health? Where will we see the benefits, besides the obvious benefits to women themselves and their partners and their families? But since the question almost always comes down to money, at what point does it start to become a break-even and even a prevention of expenditure in a woman's lifespan to have had this kind of care postpartum?
That is a great question. So the question is, when does this become cost effective? Or is there data to show cost effectiveness? And the short answer is no, there is not data to show cost effectiveness. That's why you don't have it coming to your house yet, right? Because policymakers, unless you show them the data, aren't going to do it. I can't get acupuncture covered by many insurances because for any indication, because they say there's no data. There is a flaw in the system of how we create data. But think about it. Women have been delivering babies since there were women. This isn't new. And yet, we haven't had the long-term, organization, the coordinated medical records, the foresight to follow them, what needs to be realistically 50 or 60 years, right? So that you can watch that. That's a big funding. That's a lot of money, right? That's a lot of money. that people aren't willing to give. Johns Hopkins has gotten some funding and is starting to put out little series 10, 12 years out. So there's some things happening. Hopefully electronic medical records will help with that, right? So that we can have some more coordination and sort of big data. That's one of my personal research interests. And hopefully one of my goals is to put data out there that will support this on a grander scale, as a lot of us are trying to do. So I'm sort of trying to, or we are trying to work on individual patients to try and create more footprint out there and more data. But the sad thing is, right, we have done ourselves a disservice by not following ourselves.
Mm-hmm. And what's interesting is actually, as because of our aging population, these are diseases of aging, the high correlation with that. So we're going to be seeing more and more patients just in the future, unfortunately. So hopefully we'll have the opportunities for further growth, but it is very challenging to study because, you know, someone can have a traumatic birth injury and then they don't report to us until 20 years later that actually that's what occurred.
And your private doctor had a paper chart, which they expulse after 10 years. You know, it's very hard to work backwards. So that's why we're trying to go forwards, and also just look at population themes. Yeah.
Just to piggyback on that, are you guys running any studies kind of following prevention? Since I've never heard someone speak so prevention-minded, I feel like Stanford might be the kind of frontier on the big data studies that you might get money funding behind it.
What a great question, and what a compliment that Stanford would be involved in some prevention research from the OBGYN standpoint. We don't currently have any clinical trials specifically related to this at this point, but that is, of course, one of our goals. Absolutely, we have it on our to-do list. You definitely need the infrastructure in the little community to be able to run that, and we think we're getting darn close, and so we hope that we will be able to become members of our trials. On our website, our urogynecology Stanford website, there is information on some of our clinical trials. For example, at-home acupuncture style therapy was one that was recently open and closed, so you can always go to our website and see what is open.
In the Pelvic Health website as well.
And our Pelvic Health Center, another
Website
plug,
as well.
up on the screen.
But what's also interesting too is, we just opened in July. So we all have lots of ideas. And I think we're having our first retreat meeting of the minds of the doctors to discuss research objectives going forward, I think next month. So that it's all very exciting, and we're hoping to do a lot of good work going forward.
I think so.
I think that's it.
Thank you very much.
Yeah.
Very welcome. Thank you all again for coming out.